everyone, I'm Shairha, one of the education consultants here in AECC Global Sydney, and we are here today for a live Q&A session to answer all your questions about nursing. It's actually our first live Q&A video for the year, but we will be doing more in the next few weeks, so always stay tuned and feel free to participate. Today is about nursing, so it could be about anything about the course itself, admission requirements, admission process, and even the PR application as well. So we are joined by Mohsen. He's one of our registered migration agents who will be assisting us to, give us further information on how to apply for PR. Hi there, Mohsen.
Hi, Shairha, how are you?
I'm good.
Yeah, so what Shairha explained that we're gonna explain a bit about the coursing, basically the course for nursing occupation, and also a bit of information regarding PR pathway and how you can get into permanent residency, or the right pathway to get permanent residency. So yeah. If you have any question, you can just post your question and then we will look at it. If we have enough time, we go through all the questions. Otherwise, you can contact us through our website or through our phone number, and then we can discuss your individual cases. So yeah, so
Okay.
Shairha, so I've got first question here which posted, and this is more regarding admission, which you can probably explain more in details. So
Okay.
the question is regarding the conversion program for international students. What are the conversion program available for international students? And there is another question about the new pathway for overseas registered nurses. So if you can explain and elaborate in more details, that would be great.
No worries, Mohsen. Thank you for reading out the question.
Yeah.
Well, if we are actually talking about, conversion program for nursing, there are options across Australia. In Victoria, I think we have Deakin University. In Western Australia, we have Edith Cowan University and Curtin University. Although, unfortunately, this program is not offered in all universities. Although sometimes, even if the university do offer this program, some do not lead to registration. So students have to be very mindful of this. And also, this conversion program is only offered for those applicants who are overseas registered nurses already with work experience as a registered nurse within the past 5 years. Although, of course, sometimes you can see students, that they are completing the bachelor's program for 1 year, but they do not have work experience overseas. This can happen. So as long as the student actually completed the degree of nursing overseas and obtained the nursing registration just recently, they might be able to complete the Bachelor of Nursing for just 1 year, but this is assessed by the university in a case-by-case basis. Going back to the options, we have Deakin as mentioned. So Deakin University is offering this program in their 3 campuses. So that's in Burwood. The other one is in Waterfront, Geelong. The other one is in Warrnambool. In ECU, it is offered in their Southwest and Joondalup campuses. In Curtin University, it is offered in Curtin Perth campus. Okay, so that's basically that for the conversion program. But
so,
let's
Shairha,
go.
can I ask you also, like generally, how long is the duration of these courses? Like normally, how long does it take to finish the courses?
Well, if we're talking about conversion, it's just 1 year.
Yeah,
Usually
1
it's
year.
still a Bachelor of Nursing, right? It's the full 3-year course, but then they will be able to complete that 1 year because of the offshore qualification. So that's just a
Yeah.
credit exemption that is granted to them.
So if you don't mind, I just add a bit here. So look, if students like down the track, their plan is to apply for temporary graduate visa or get into permanent residency in the future, I think it's a see, it's up to the student to decide, especially if they have done nursing course in like overseas, and they want to study 1 year bachelor here. But in the future, if your plan is to apply for temporary graduate visa, one of the options that you can have is just to study 2 years nursing here.
Correct.
So instead of getting like 2 years credit transfer, you can get 1 year credit transfer. But down the track, it's going to be useful for you, because if you do 2 years of study of nursing here, then you will be eligible to apply for 485 visa, like temporary graduate visa, post study work. And that's going to give you this opportunity to work full time here after you finish your study. And then you might have better chance to apply for permanent residency, which I'm going to elaborate in more details later on when I discuss about permanent residencies option. But just to give you this information right now, when Shairha discuss about the course, yeah, just whenever you decide about the course, just think long term what's going to happen in the future. Like, okay, let's, if you finish your study of nursing, what are your options after you finish your study? So if you think that in short term you won't be able to get into permanent residencies, then maybe you can think about doing 2 years course and applying for temporary graduate visa in the future. Okay, yes, Sharon.
Yep.
So the second part of the question was about the new pathway for overseas
Mm-hmm.
registered nurses.
Yep.
I think there are some information about the new program. If you can
Yep.
elaborate
Sure,
more.
sure.
Yeah.
No
Mm,
worries. Just to add up, Mohsen, on what you've actually said, I do agree. I absolutely agree on the your recommendation that if students want to study or targeting the 485 visa later on, then that's good for them to do the 2 year study. That's not a problem at all. They can always just inform us, and then we'll just process for 1 year credit instead of two. So going
yeah.
back to the second question, um, that's regarding the new pathway, right? So in March last year, the process to get an Australian nursing registration has been changed for overseas registered nurses. So instead of taking a bridging program, the applicants are now assessed based against three criteria. So most of our students are falling under the criteria of needing to do the OBA. So OBA
Yeah.
is the outcome-based assessment, wherein the student will have to take the multiple choice question exam and then the objective structured clinical exam. So the stage one is actually to pass the multiple choice test first, and then once you've done that, they can progress to the clinical exam. And of course, once the student have passed both of these, given that they also supplied all the required documents for the registration, then they can get the registration.
Yeah.
So, and also just to add up on this one, because I've been speaking to a lot of students who are already registered nurse overseas and have, work experience even within the past 5 years, but they're still hesitant to apply straight away to OBA because
Yeah.
they're not sure if they can, just wing it and pass
Yeah.
and get the registration, right?
Mhm.
So one thing that I would like to share to our students out there is that we have partner institutions that
Yeah.
offer an OBA preparation course. And this might, help them pass the test and also guide them on how to apply for the registration later on after passing the test. So yeah, for those students, just make sure that you get in touch with us and we'll be able to
Mhm.
assist you with that course.
Sure. Yeah. Okay. So, Shairha, I've got another question regarding the fees and English requirement for Bachelor of Nursing. If you can, I know there are a lot of providers in Australia, like different universities, they have different fees. But
That's
if you
right.
can just give us some, like estimated cost about like tuition fee and also the
Mhm.
English requirement to enter to this
Yeah.
program, that would be great. Yep.
Yep, no worries. So let's actually
Mhm.
start with the different types of Bachelor of Nursing because there are
Yeah.
different types and a lot of students get confused. So the
Mhm.
standard duration for Bachelor of Nursing is actually for 3 years. So if you're a fresh
Yeah.
student coming from year 12 or coming from any other background, you will have to apply for Bachelor of Nursing standard
Mhm.
three-year program.
Yeah.
The second type of nursing is the Bachelor of Nursing EN entry, or the second year entry. So most students who actually did a diploma pathway, let's say, for example, diploma of health sciences or
Yeah,
diploma of nursing, once they've completed those course, then they will start with a Bachelor of Nursing, not on the first year, but on the second year. So they
yeah,
will be able to complete the course for just 2 years. The third option or type of nursing is the Bachelor of Nursing graduate entry. So this is also for a 2 year course. So if the student already have a bachelor degree equivalent, they might be able to apply for this one and then complete the course for 2 years as well. The last type of nursing, as we were talking about a bit earlier, that's the conversion program. That
yeah,
program is just for 1 year. Now let's talk about the fees. So the
yeah.
fees here is actually a bit there's a
It's
huge
very.
range. Yeah,
Mm-hmm.
it depends on the university. There are a lot of universities offering it below. There are few universities offering it
Mm-hmm.
below 30,000, but most of the universities will offer it between 32,000 to $36,000 per year.
Yeah,
But with the Bachelor of Nursing graduate entry, it's a bit expensive. It's actually sitting like towards the end of the range, around $39,000 a year, given that it is a post graduate qualification already.
yeah. So I just wanted to add a bit here. It's like, for example, student basically mentioned that. So what if I start with diploma of nursing and then later
Yeah,
on I want to get into bachelor of nursing? Look, in terms of PR pathway, your pathway would be different because if you finish a diploma of nursing, you become enrolled nurse. So if you become enrolled nurse, so you have option of applying for state sponsorship, depends on which state you basically meet the requirement, but you don't have much option because you are not a registered nurse yet, you are just enrolled nurse. So if, for example, it's not practical for you to directly to enter to the bachelor of nursing program, what you can do is you can start from diploma of nursing. When you finish the diploma, you might have option of getting basically into state sponsorship. At the same time, you will get a credit transfer toward your bachelor degree, which you can complete your bachelor and explore your option after you finish your bachelor of nursing. So it really depends on your situation. uh, the sooner you start your bachelor degree, obviously the sooner you can get your nursing degree and you can get to registration. But if this is not practical and you want to start with diploma of nursing and later on decide about your bachelor of nursing, that could be also an alternative option for you. So you will get absolutely, as Shairha mentioned, you can get some credit transfer toward your bachelor degree, and later on you can finish your bachelor shorter than 3 years, or the full bachelor course.
yeah,
Yes, sir.
and also just to add up on that one, right?
Mm-hmm.
The English requirement actually for nursing, regardless if it is a diploma or bachelor or master's, it has to be an IELTS 7.0 at
Yeah.
least overall, and with no band below 7 as well. So if
Mm-hmm.
you've mentioned there are options for students, if they feel like it's not practical yet to go straight for the Bachelor of Nursing,
Mm-hmm.
they can opt
Yeah.
to study a diploma. But it's a bit tough as well for some students because the Diploma of Nursing requires 7.0 IELTS as well. So another
Yeah.
option to consider is the Diploma of Health Sciences because they have a lower English requirement, and then we can process the application package with a Bachelor of Nursing.
Sure. Yeah. So I have another question here, actually also posted on
Yep.
our Facebook Live, regarding
Yep.
a master degree in nursing. So
Mm-hmm.
this is also mainly for admission. So somebody
Yep.
asked, can I do a master of nursing? I guess if you don't have nursing background, or even if you have, and you want to study master of nursing, there could be some options. But if Shairha, you can explain, okay, what are the requirements and what are the possible options if somebody wants to study master of nursing without having nursing background, if it is possible, what are the providers?
Yeah, so just to simply answer that question, yes, it is possible. There
Mhm,
are a lot of options now for Masters of Nursing, but not all Master of Nursing leads to registration, so we have to check which one will lead
mhm,
to registration after completing the course. So if you are coming from a different background, it's still okay, but there will always be a GPE concern on this, right? But as long
mhm,
as students can justify the change of career, then that can be done. Um,
mhm,
as I've mentioned, not all Master of Nursing will lead to registration. I think our students should be aware that there are options like Master of Nursing Practice in Monash University, Master of Nursing Science in University of Melbourne, and I think Master of Nursing Practice pre-registration, CDU Sydney, is also very popular now amongst our
mhm.
students. So once a student complete these courses, they will be eligible to apply for the nursing registration later on.
Okay, yeah. So what Shairha explained about Master of
Mhm.
Nursing, the critical point here is that if your long-term plan is to apply for permanent residency, you have to enroll in a program that leads to registration, because
Correct.
part of the skill assessment requirements for the nursing occupation is that first you need to have upper registration. If you cannot register as a nurse, then you would struggle with applying for a skill assessment and later on for permanent residency. So just be aware that if you want to get into Master of Nursing, you have to enroll in a program that leads to registration. You can contact our education consultant. They discuss with you about, okay, the program, they elaborate the basically the course, and make it clear for you that, okay, this course leads to registration.
Correct.
And also in terms of changing career, yeah, so there are different situations. Sometimes when, let's say, you study bachelor in different discipline, then you're currently holding 485 visa, temporary graduate visa, and you want to get into Master of Nursing. So that is possible because you don't need to apply for another visa. You can just use your temporary graduate visa and apply for and study this Master of Nursing course. Let's say if you finish your basically student visa, or you are about to finish your temporary graduate visa and you want to apply for another student visa to study Master of Nursing, then we have to sit with you, we have to discuss your situation, we have to elaborate in the visa application why you want to study this course, and justify the further study. And if, well, this is a good option for you as well. But what I'm trying to address here is that if you, for example, you're holding temporary graduate visa, you think that, okay, your occupation is not in PR list, or getting permanent residency through your current study is very difficult, and you are planning to do further study, this course, Master of Nursing, could be a very good alternative for you. Not only in terms of future career, it would give you this opportunity, but also regarding PR pathway, it can assist you in the future to get into permanent residencies program.
That's right.
So yeah, again, the same basically similar type of question that, okay, if I study Bachelor of Nursing, what are the options for permanent residency? And is there any advantage if I study nursing than other occupation? So, see, for nursing student, if you finish your study, you need to get your registration through APRA. That's the fair system. Then we have to do your skill assessment through ANMAC, is the basically authority that do the skill assessment for nursing occupation. And after you got your skill assessment outcome, then depends on your point, we can apply for expression of interest. Well, if you become a registered nurse, you would have option of applying for 189 visa, which is a skill independent visa. You have option of applying for 190 or 491, depends on, because these are state sponsorship, so it depends on your basically which state you graduate and if you meet the requirement of state. I just give you an example. For example, in Victoria, there is an option for registered nurse to get permanent residency through 190 program, but there are specific requirements. For example, you need to work as a registered nurse for at least 6 months to be eligible for this program, and they only basically sponsor certain nursing occupations. So because you may know that nursing occupation has different stream. For example, aged care, mental health. You can practice in critical care. So depends on which area you practice, you might be eligible to be sponsored by Victoria State. Again, different state, they have different requirement. Yes, so I'm just looking at the question here. So some questions related to the same basically requirement. Somebody asked if I have done my skill assessment as a registered nurse and they assess me as NEC, because normally if you haven't have experience much or you haven't got experience, fresh graduate, they would assess you as RN NEC. So the question is that can I change the answers if I get some experience in different stream? So that's a good question, and also it can relate to the previous question about the Victoria State. If you complete your work experience minimum like 260 hours uh, in one of the nursing basically specialization, like for example, if you did work in aged care facility, or if you work in emergency department, or you work like in facility that they are dealing with mental health. So depends on your type of experience, you can change your skill assessment. So normally minimum requirement is that you need to have 260 hours of work experience that meets the task and responsibility that required for that particular stream. So if you meet that requirement, definitely you can change the answer score and you might be eligible for a particular stage. Because as I said, for example, recently the new change happened in Victoria that they only sponsor certain stream in nursing occupation.
Mhm.
So that can be, the way to get into that pathway.
Yeah,
Okay.
that's good to know, Mohsen.
Yeah.
Just
Mm.
a follow-up question for that
Mm.
one. So
Mm.
you've mentioned that they can change, right? So
Mm. Mm.
is it done through UNMAC?
Yes.
Just to clarify for
So
them.
yeah, the same skill assessment body, because there is an
Yeah.
option for nursing basically client that they want to change the answers go to particular stream. We
Mm-hmm.
can basically ask the skill assessment body and MAC to
Oh.
reissue the certificate of assessment. And
Mm-hmm.
as I said, minimum experience that you need is like 260 hours of experience in one of the specific stream, and you need to meet the task and responsibility related to that occupation. So if you
Okay.
have that requirement, basically we can change your underscore. You can contact me directly. We will provide you
Mm-hmm.
with our contact numbers and details at the end of this like live session, and you can discuss with me in more details. So we decide, okay, which specific nursing stream you meet the requirement, and then we can basically discuss with you your best option. Yep.
Yeah, sure. Do we
So
still have questions?
yeah, there are some more questions that I have here.
Okay.
It's regarding a family sponsor for registered nurse. So, as I discussed before, for nursing occupation, uh, there are uh, basically some advantage, because the nursing occupation is in the priority occupation list. So the department recently announced that nursing occupation is in the priority occupation list. So even if you have a minimum point, which is 65 point, you might have still the chance to get an invitation either through 189 or 491 family sponsor. But uh, as I said, like this question is more related to family sponsor. So somebody asked, like, if my brother is an Australian citizen in Western Australia, am I eligible for 491 family sponsor? Yes, you might be eligible for family sponsor providing that you have all the requirement. But in terms of meeting the 491 family sponsor stream, if you have a brother or basically sister or certain relative that they can sponsor you, and your relative is permanent resident or citizen in Australia, they can sponsor you under this 491. And the good news is that, as I said, you are in the priority occupation list, your chance is higher. And also through family sponsor, you will get a minimum 15 points, which basically increase your point and your chance to get invitation. So that is maybe another option for those who have relative, certain relative. Not everybody can sponsor. You need to discuss with us, okay, what's your relationship and what document you have to prove that, even in different state, not only Western Australia, different state. But as I said, you need to have a certain document to prove the residency requirement and also the relationship requirement. If you meet those requirements and you meet all the other points, basically criteria, you might have this option, which is a great option. It's a pathway. It's not a permanent residency visa, but it's a kind of temporary visa which leads to PR. It's kind of provisional visa that leads to permanent residency visa. So that's also another question. Also, somebody asked, like, here, if I complete diploma of nursing, do I still have option to apply for permanent visa? Well, technically you might have, but well, I explained before, the options are not similar to someone who studied Bachelor of Nursing, because your options are very limited to uh, state sponsorship and either 190 visa or 491 state stream. So not mm, like similar to nursing, like registered nurse, but there might be some option. But as I said, like, this is a good starting point if you want to get into this program. But later on, if you see that, okay, you don't have option to get into permanent residency and you want to continue your study, you will get some credit transfer toward your Bachelor of Nursing, and later on you can apply for permanent residency or even like temporary graduate visa after you complete your Bachelor of Nursing. So it depends on your situation. But the short answer is that practically, yeah, it is possible, but it's very competitive. Your points gonna be less than, those who study Bachelor of Nursing, but it's a good pathway. Yes.
Yeah. So Mohsen, do we still
Yeah,
have more
I
questions?
think
Because we
we're
are
running
running out
out
of
of
time.
time.
Yeah.
Yeah, but
Yes.
definitely you can contact us in terms of admission, in terms of
Mhm.
skill assessment. In, like, if you have PR inquiries, you can discuss with us directly, because as I said, we can't go through all the question in the live in the short time, and we need to also discuss with you individually to see, okay, what are the best option for you. Depends on which state you study, basically what you study, and what course you completed. So contact us. We will basically either phone appointment or face to face. We will see you, and we can discuss your individual circumstances.
Yep, thank you so
Okay,
much, Mohsen, for
no worries,
answering
Shairha.
all those questions. I
Thank
think our
you.
students are very interested with, the PR process and everything. Well,
Sure.
I guess that wraps up our first live Q&A session for today. Thank you so
Yep.
much for joining us, and join us again next Tuesday at 1:30 p.m. for another
Mhm.
live Q&A session. Ask us anything about studying in regional areas. For more information regarding nursing courses and PR pathways, visit our website at www.aeccglobal.com.au. Call or visit any of our offices in Melbourne, Sydney, and Brisbane on weekdays from 9:30 a.m. to 4:30 p.m. You can also follow us on Facebook and Instagram for more content and updates regarding courses and visas. And lastly, we would also like to invite you to our first event of the year, right, Mohsen? We are
Yes.
having the virtual semester one application week. So that's going to be from 27th to 29th of January this month, 2 to 5 p.m. So meet with over 50 quality hire and vet provider across Australia through one-on-one consultation with their representatives and choose from a variety of scholarships available. Get one-on-one visa and migration consultation and attend our migration webinars to learn more about specific state migration updates. To register, just follow the link on our post. Thank you again, everyone. See you
Okay.
all
Thank
next
you.
week.
See you all.